So dual diagnosis or co-occurring disorders, or in the mental health field, MICA, mental illness chemical dependency, really refers to the fact that there are two things going on at least. Could be three or four, but essentially we're talking about two illnesses, and of course, as with any combination of illnesses, one illness complicates the other. You know, we have great experience in the rehab and detox side of our facility with dual diagnosis in our pain program. You know, one diagnosis is addiction, the other diagnosis is pain. But in the case of this afternoon, we're going to talk about psychiatric illness, and you know, it goes without saying that each illness is going to affect the other, and each illness is going to interact with the other, and when there are two illnesses present, it's going to be worse than if there was only one. The illnesses sort of operate independently in the sense that addiction goes its way and the mental illness goes its way, but obviously if you have addiction, there's going to be some crossovers between the addiction and the mental illness. I think I'm being redundant, but the kinds of stuff we're going to see is alcohol causes depression. So people who drink too much have depression. Cocaine causes anxiety and panic and sleep disturbance. So everybody who has cocaine is going to have those symptoms, and when cocaine goes away, people have depression. So we'll see both cocaine dependence and depression. People with attention deficit disorder, whether it's a real label or not, take stimulants, and their stimulants calm them down, but they also may have an exacerbation of their addiction by taking their stimulant medication. People who have chronic pain are called upon to, or given by doctors to have opiates, and of course opiate complicates addiction. So it's going to take some skill, as we all know, to sort out which came first, and is there really two disorders going on, or is really one caused by the other. We need to be mindful of which of those occurrences happens, because it's going to affect how we treat them. If we have somebody who's got primary addiction and they're depressed, we really need to sort out, is their depression related to their alcoholism or their cocaine dependence or their opiate dependence, or do they have this second diagnosis that Joan's going to describe in a few minutes. Likewise, if we have somebody who's manic and all over the place, you know, in an unsophisticated treater, they would get treated with medication for bipolar disorder when actually they're just coming off a cocaine run. So we really don't want to confound one diagnosis with the other. On the other hand, we really don't want to ignore the dual diagnosis if it's present. So if somebody has a major depressive disorder and we don't treat it, that's a relapse trigger. You know, we need to make sure that if somebody has a bona fide dual diagnosis, they get that treated, and sometimes the treatment is medication or cognitive behavioral, and I think, Joan, you're going to talk a little bit about that. Mm-hmm. So again, I mean, this is a complex interaction of things. Our job as clinicians is to tease out and separate out, is there a dual diagnosis? And probably the best way to know that is either to wait and see, or to have a history of pre-existing mental illness before the drug addiction happened. That is, before they had an active experience of drug addiction. So if by 16 they had a major depressive disorder, as it'll be defined in a minute, or they had bipolar symptoms at age 13, and they then developed an addiction to drugs, they probably have a mental disorder, and they're probably going to need medication to treat it, and we've all seen cases like that. So we don't want to be therapeutic nihilists, no drugs, no how, never, never, but we also don't want to over-medicate people who really have addiction as a primary disorder and will respond to addiction treatment, which is recovery, you know, and that's what we do the best. So is that clear to everybody? I mean, it sort of sets out our challenge, and I think I'll turn the program over to Joan first, and we'll talk about major depressive disorder.